My name's David Green. I'm a specialty registrar in restorative dentistry. It's a 5-year training programme and I'm currently based at Birmingham Dental Hospital in the West Midlands. I love restorative dentistry. It's a great sort of pathway and it's a great sort of career choice in my opinion. It's very sort of technique sensitive. You have to refine your trade and get very, very good. And you also have to get good at different areas. So restorative as a whole incorporates prosthodontics, endodontics, periodontics. Each of those disciplines you have to refine your trade and technique, and then you use that to treat patients with complex sort of symptoms and findings. Part of who we treat are oncology patients, so acquired maxillofacial defects, also patients with cleft lip and palate, patients that have undergone sort of substantial trauma, and patients with hypodontia or missing teeth. So it's a very, very interesting speciality, it's very dynamic. From the training program as well, you develop sort of leadership skills, you develop the ability to teach. I've also gained sort of additional experience as well as clinicals, so that would be sort of management positions, leadership positions. I think in Birmingham you have a really, really good standard of life. You can buy a nice house, you can enjoy yourself, and it's just a great city to be in. There's lots happening and lots going on. Because we don't have any competing dental hospitals, we get the whole broad array of treatment. I feel one of the real benefits of working in the Midlands as well is we've got some beautiful purpose-built hospitals. Also, we're very lucky to work with our maxillofacial colleagues and orthodontic colleagues, but particularly some of the MaxFax colleagues at QE. And we develop very good relationships with them. We undertake MDT clinics where we sort of plan complicated patients like our oncology patients or our hypodontia patients. And that's a great learning environment. So I think specialty training is fantastic. I think it's an amazing experience. It pushes you to the next level. So part of the training is it's a peer review process. So you constantly have people that want you to improve. There's some great opportunities to do some dental core training. For dental core training as a whole, you get exposed to different specialities. You can find what you're interested in. Other things I would advise before you pursue a role is to look at things like job specification or personal spec of registrar positions, because then you can look and actually see what skills and what your CV needs to consist of in order to get training. I would advise contacting people perhaps a couple of years ahead of yourselves or people currently in those positions, because it gives you a really good opportunity to learn firsthand what the pros and cons of that training is. Some of the earlier dental core training jobs tend to be split, so you could do 6 months in oral surgery, 6 months in restorative, and this is a really, really good opportunity to get exposure to actually see which aspects of dentistry you like. I'm currently in my 4th year of registrar training, so I've got just over a year left. I've previously done my MRD in prosthodontics in London and also submitted my MSc, so I've got some really, really good grounding. Every single day is reflection, is learning, is developing. I will hopefully work as an NHS consultant, which requires different skill sets. Restorative training in the Midlands has been an excellent opportunity.